I think it starts with a perception gap where, again, a patient is used to working with Amazon. Everything is connected to my thing. I can find my orders, this and this and that. And then when they call their health system, they don't know that the IT is not, the most up to date technology. They don't know that their data is spread across 7 different systems and no one person has access to all of them. And that causes that frustration.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the change is permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As builders and operators, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about Walmart's new clinical trial centers. What's the goal of the new centers, and what happens when we continue to underestimate how retail health can reinvent itself? I'll talk about that. Then I welcome Rom Cohen, co-founder of Hyro, to talk about the state of patient communication, Hyro's new research on the topic, and how an unsophisticated approach to AI just means lots of people don't get treated. I'm Jared Johnson. Let's get it.
Flava of the week.
Big retail is full of learning companies. When they try one thing and it looks like it fails, they learn again and try something different. Take Walmart's news last week that they're expanding access to clinical research. According to a news release, over the next month, Walmart Healthcare Research Institute and Care Access will open their first clinical research locations in Houston and Tyler, Texas, and Dalton, Georgia, part of a new effort known as the Clinical Trial Center by Walmart and Care Access. These locations open the door to something new for the community, bringing clinical trials into everyday spaces closer to where people live, shop, and spend their time. Why, you ask? To expand access to clinical trials and research and help improve care for underserved communities. Historically, research hasn't reflected the full diversity of the community. Many individuals have been excluded due to barriers like distance, time, and cost. So by meeting people where they are, WHRI helps remove these barriers and creates more opportunities for participation and helps improve care for underserved communities. Clinical research hasn't typically fit into everyday life, as you realize. Opportunities are often far from the communities that they're meant to serve, and participation can be difficult to navigate. So it's interesting to me that Walmart sees a different path forward, one where the future of health and medicine is built not only in major medical centers, but also closer to home in the communities where people live and move throughout the day. What's the consumer lens? While these spaces may look like traditional clinics from the outside, they represent something new. They bring medical innovation directly into the community. They'll be located at the front of Walmart stores where many customers will pass by them as part of their daily routines. This will create simple, everyday opportunities to learn about clinical research and consider participating in ways that they may not have felt possible before. On the flip side, when I take a step back, there's a danger in pronouncing retail health dead at any point, because it means that history is bound to repeat itself, with traditional care largely ignoring new retail offerings, and consequently, consumers not having all the information they need to consider these new choices. In this case, these clinical trial centers are a signal of a new direction for a familiar name, and I, for one, will be paying attention to what comes next. Let's consider how new directions in retail health can address gaps in clinical research and other important areas where medicine doesn't yet reach the communities that it serves. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. All right, everyone, let's get into the flow. Most of you, I would assume by now, were able to tune in when I had Israel Crush from Hyro on not too long ago, a few weeks ago. And to continue that conversation, I'm now here with Rom Cohen. He's the COO and co-founder of Hyro. Rom, welcome to the show.
Hi, thanks for having me. Very excited to be here.
You know, it set a pretty good stage, I would say, with Israel. And so we do have a tough act to follow here, but I'm feeling good about where we can go with this stuff. Let's give you a minute or two here just at the beginning, help our audience understand a little bit about you. I think I like to understand, I've been starting to frame it this way lately, of helping us to understand your point of view and where you're coming from on things. I've been asking if they could boil their philosophy down, like their philosophy about healthcare or access, into a couple of core beliefs. it's been an exercise for me to try to do this too. But like, where, just tell us where you're coming from, I guess, on things, and we'll go from there.
Yeah. So first of all, thanks for having me. I'm very excited to be here. But I would say as someone that most of his life focused on like HCI, the human computer interface or interaction, and moving to the United States and facing an injury and then needing to understand how to even get access, kind of really shoved into my face the problem where there is a reality of an access problem. We're used to getting a retail-like experience in a lot of different places, be it on the call center with AI or just even your applications. And you see that with healthcare systems today, you just don't have that. And I think that's one thing that we do need to look at and understand that there is a gap between the patient expectation and the actual thing that we have going on today. And the second thing is AI is booming. It's amazing. Healthcare has been one of the best adopters of it so far, and doing it in a very responsible way. So this is the second thing where I truly believe that there is an infrastructure issue in how data is managed in healthcare, and AI can really prop it 15 years faster than it could have before.
Thank you. And I want to latch on to that second one here for a moment because you do hear a lot of not only hype, but just, I mean, toxic freakouts, I guess, right? What makes you confident that AI, can get us to where
Yeah.
we want to go?
So there was a big MIT study showing that like 95% of the 2024 early 25 AI initiatives did not have revenue, but there was a different report that talked about at industry specific things, and actually healthcare was one of the best return of investment verticals of AI, because I do think, as I said before, there is some sort of infrastructure gap, be it the electronic healthcare records or where data is stored and how it's connected to connect everything that has to do with patients. So each thing with AI really pushes you forward from, the simplest ambient listening. So when you see your doctor, you can talk to them and you don't feel that they're in front of a screen typing, 35-year-old male, typically healthy. You're actually having that conversation. And then you have a tool on the side that really makes it better treatment for all, both for the provider and you. And I think what we are doing with patient engagement has the same type of thing. It is a tool that can help patients get things faster because it kind of overrides limitations in the past and connects different tools that were not really connected before. And I think that's why healthcare specifically, from a lot of other regulated industries, is so ripe for innovation with AI.
I like that. Well, it made me think maybe we can show more ROI and promise in healthcare because we were so far behind in the first place, like because we have so much room to grow with things
Yeah,
that are easily solved.
I think a lot of it had to do with just how things were done in the past, and was really hard for the digital leaders to be able to push things forward. This is one of the things, by the way, I think COVID-19 did a really good job of forcing us to be more digital forward in healthcare. And I think no healthcare leader that I've met in digital or IT or even in the operational patient experience space is not happy that that is the one good thing that we got out of it. It did elevate video visits and a lot of the digital experience forward.
Yeah, very true, very true. It's been a different world ever since then, and needless to say, it's changing quickly. And speaking of, I know we've mentioned access a couple of times, but I'd love to dig into a recent report that Hyro just put out. It was your 2026 State of Patient Communication report. Let's dig into that because I think there are a lot of insights into that. Let's start with maybe a couple of insights that were either the most interesting or surprising to you, and why they stood out.
So that's a good question. And I think what I liked about the report is it really reaffirmed hunches or anecdotal things that I've seen doing this for the past decade or so. And I think kind of like what I alluded for before, we've seen that I think 93% of patients say they are comfortable using AI and other digital tools for their healthcare journey. And we just don't see the support for that. So having that piece of, I think it's 93 percent of systems and 86% of patients agree that they would want to do that. Now we need to bring them the tools to be actually able to do that. Uh, and I think the most worrisome part, and I can say I know it from personal experience, 72% of patients said that they are putting off care because it's so hard to get an appointment and really understand what's going to be the cost structure. How many appointments would I need for what I had? And I can say personally, I had this as a student with a rotator cuff injury that I just didn't treat it. And it's still bothering me today because I was not sure do I call my insurance, the health system, and how do I get treated? And that navigation fear just I had paralysis and I didn't do anything. And I think that's probably the most dangerous part of what we're seeing today.
I would agree to that. We've heard that a lot on the show that once we recognize and acknowledge inside healthcare, it's so easy to be, I guess, like on the inside and forget that we are not talking about like people in a different audience. We're all talking about all of us as healthcare consumers. And when we keep that in mind, we approach things a little differently when to your point of being able to point to easily to an experience yourself, in some cases with a loved one who did not have an easy time navigating their experience. Like that's what this all keeps coming back to. And like you said, what does that lead us to? Just to decide not to treat something, to not seek the care.
Mhm.
That's the real competition here. And there are so many aspects of that that we just always need to keep in mind because it's easy to get lost in the just trying to either gain market share or beat a competitor. But the real competitor is the one that like nobody can unfortunately quantify truly as well, like who didn't even seek the care in the first place. So to your point of being able to enable better experiences and kind of regain the trust of patients as we go along, like that's I feel like that's the context. That's the greater view of what we're talking about here. Do you agree with that? Like is that helpful
Yeah,
to kind of frame it that way?
I think it does. And I think a lot of it does show that we're leaving a lot on the table, right? That there are a lot
Yes.
of patients that go untreated today, and we really don't know why. And this is something that I get really passionate about in our industry and what we do specifically. Where at Hyro, we're taking almost all of the patient interactions, conversational, be it we reach out to the patient or they call in or use the AI web agent that now when you have one place to show you what patients are talking about and it's not segregated and anecdotal into different places and even in the call center, your human agents are not writing down small notes and then one person takes all of it and says, oh, this is an insight or something like that, that we're giving true actionable insights. And the thing that I find has the best resonates the most is, hey, people hang up when they hear when the next available appointment you have for a dermatologist. Are you even aware that that doesn't go into your scheduling queue? So you're not even aware of how long they need to wait, but they're dropping the call. And I'm not even saying going to a competitor. I assume people will just say, forget it. I'll call again next week. And then they never go. And again, with the healthcare situation happening across the United States and the whole world, I do think going to primary care, going to your annual wellness visit, are things that when I started to do it, I started to feel more healthy. You don't go to your doctor when something's wrong. You go to make sure you have a good active life cycle. So you don't go and you need to fix a problem, you can prevent it. And I think these specific things are harder to do when there is so much friction in going in and doing something like that. I hope that
Yeah.
really gives you that. And if I may, like the one thing that really excited me as a company that did something that I thought was really well is One Medical, where I when I started using it, I felt, "Oh, this is such a nice thing. Now I am going to see my primary care provider." It became way more seamless because they really took that digital experience forward. And I think that is the direction we should all go strive for.
That's a great example. I mean, talk about a differentiated patient experience with One
Mhm,
Medical. And I've seen that myself too. I don't have One Medical, but I have a membership with a direct primary care provider, right, for myself and my family. And
mhm.
it has shifted my mindset to understand how proactive care actually can actually exist in my life, but also like reasonably priced. And it has changed my approach likewise to say I'm not going to wait until I'm sick every time to engage. And it's a lot of education to understand what those areas are that make sense and what doesn't. So it's a great part of the conversation, I think, to include. And I imagine there were other pieces in the study. That's kind of my understanding that refer to this patient tech disconnect, especially when we talk about access and scheduling. When we look at the barriers that exist right now to keep those types of differentiated experiences from happening. We're still talking, for the most part about difficulties with navigating, I believe,
Yeah.
especially when you start talking about a large health system, which is just in its own category of complexity of how much there is to navigate in the first place.
Mhm.
Did the report address that? Did it talk about that patient tech disconnect?
So the report goes into that, but it shows more like the anecdotal evidence, and there is things that I think patients are unaware of, and I think that is something that we really learned once we got deep into health systems, and when we decided that we're focusing solely on the not just healthcare entirely, but just health systems and large hospitals where there is a human bottleneck here, and I think it starts with a perception gap where again, a patient is used to working with Amazon. Everything is connected to my thing. I can find my orders, this and this and that. And then when they call their health system, they don't know that the IT is not, the most up to date technology. They don't know that their data is spread across 7 different systems and no one person has access to all of them. And that causes that frustration. So I think that's a first big gap that we have. And another thing, which I think is not really known, is the physician groups that are a huge part of these health systems like to work in the way they do today. They don't want to necessarily open their schedules up for online scheduling, or they want to keep control and they don't want to work in a standardized fashion. And this is a reality check that a lot of our champions in healthcare IT are facing is how do I convince this practitioner that's been working for 30 plus years that someone in a call center can schedule an appointment for them and not just necessarily their front desk. Or then the next stage to go to AI automations. We're still, when it goes to we need to standardize before we can automate. A lot of systems are still there trying to convince providers that it's okay to let go of some of these things. And lastly, there's also agreements that they have, contracts between different types of groups or agreements that mandate exactly how things should go, be it like what providers you show first and other things that you also need to maintain. All of these together make it much harder to do those things, even to schedule an appointment. There's so many moving pieces behind the scenes that make scheduling a radiology appointment much more complex.
Yeah, there's so much to it. You're right. I'm glad you mentioned provider groups, like the medical groups, because that is not just a factor. But I remember having a lot of resistance then when I worked at a provider to even the concept of scheduling at all. And so it's pretty vivid. And at the same time, I think I've learned since then. I'm like, there's a reason why they do, and they do have things in a certain way. So now you're just talking about being able to support them and have the tech that they need to support. I guess not all the reasons that they resist it are totally valid in my mind, but I get it. Like I get why they don't want to open their schedule enough.
Yeah. As someone that has, I think, mostly doctors in my family, the black sheep that went for tech, and you saw I stayed close to home. I see where they're coming from, but on the other side, I can really see the reluctance to adopt new technologies. My aunt, for example, just as an anecdote, she's a radiologist. And I remember her talking about AI imaging software 15 years ago. And, being like, I went to school for so long, no machine is ever going to replace me, to hearing her today saying, I love this. It gives me a safety net. It doesn't get tired. It finds my mistakes. Apparently, after lunch, I make more mistakes in how I review cardiac CTs. So you do see how providers, when they're prompted correctly to see the value of how it will give them the ability to treat their patients better, are more open to this. But when it comes to scheduling, it's not necessarily the quality of care that they see. And then there is a lot of work in politics involved in trying to get them to open up their schedules or even just allow different people to schedule appointments for them.
Yeah, exactly, exactly. There's a term that I've heard that I'm not that familiar with, but my understanding is that it helps the customer experience here. What we're talking about, it's called smart routing.
Mm.
Can you tell us what that
Yeah.
is and kind of how it does help consumers navigate?
Yeah, 100%. So a core part of what we do, or maybe the basis, the essential piece of the Hyro product is when someone calls in to a call center, instead of getting that greeting and then for scheduling, press 2, for this, press 1, we turn it into a more conversational experience. And what we notice that happens is instead of having those, 5 options and then maybe with a sub menu, 2 others, so you're taking a total of 10, people say what they want. And then that makes it better, more smoother, but also they have about 60 different options. Things that we notice is people would start to say, I want to speak to a nurse instead of what they had before. So smart routing at its core is the ability to let people say what they need and to take them to the best destination possible. But here there is a nuance, and That's why you need AI experts to help you manage these things. Because we've noticed people, for example, ask for nurses, but I want to talk to a nurse. We talked about all the issues navigating to tell me about my lab results, to tell me about how do I schedule my next appointment. A nurse is the most trusted resource at a health system, but on the flip side, they don't. They have very specific things they need to focus on, right? Triaging, helping patients with actual severe symptoms. So you don't want to bog them down with administrative stuff. What we do with our smart routing piece is understand the business logic of the customer. And then even if someone says, I want to speak to a nurse, it will refine, like, why do you want to speak to a nurse? And then understand that bigger part of the intent and take them to the right place. Sometimes it is a nurse, sometimes it's something else. And I think the best value here is we had a big customer in California that their head of nursing emailed us saying that we reduced 50% of people calling asking for a nurse. And they really focused on the things they needed. And again, nothing makes me happier than seeing both patients getting what they need, but also the providers focusing on the care that's why they became providers for.
Okay, cool. Yeah. Okay. So that's a big piece of this then. And it's funny, and it's probably one of those pieces that makes one of the biggest differences for the user, for the patient or their loved one, whoever's
Hmm.
doing the navigating. And is like an unsung hero is kind of my, this feature is kind of my take on that. But yeah, it's very interesting
Yeah.
to see what it takes to really put this together. It does show that there's opportunity to help reduce the complexity at the end of the day,
Hmm.
and I think the work here is just the word that comes to mind truly is noble. Like it's noble work to help drive people to the place that they want to go with their care. As we start to wrap here, Ram,
Hmm.
I'm wondering if you could put on your your co-founder hat here for a moment. What's your advice to other founders, like leaders? Someone who has an idea. Yeah, I think I can improve this one
Yeah.
part of healthcare. And we all know that's literally just the beginning. It's easy to have the ideas, but you're making something work here, right? You
Yeah.
built something here. Like, what's your advice to those others, who are either founders now or founders in the future
Yeah.
that they see a problem, they want to help, not sure what to do?
So great question, Jared. And to be honest, my advice changes like every other month or so and depends on the stage. But I would say the thing that everyone tells you in the beginning is focus, 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 right? Focus is good, focus is good. And it's hard to know what to focus on. And I think something that we, in retrospect, did well was we didn't focus too fast. But once we identify where we need to be, we doubled down, and that was like reducing your target audience can potentially make you way bigger. And you can then learn that what you're focusing on is also much bigger than the surface that you've looked at before. So earlier in our conversation, I told you that we're currently focused not on healthcare as like a big industry, but we're focused on health systems, right? Not on payers, the insurance, not on pharma, not anything else. And that decision to focus, where every time someone is going to try to pull you into something else, made us not just gain that trust, but also understand the potential of the market is literally 10 times bigger than what I thought a year ago. And then every time I learn more, I'm like, whoa, it's even bigger than it is. So focus is really important. Don't do it too early. You need to kind of spread out, test the waters in different things. But once you get the good signals, don't hesitate to go all in. And this is something that I think took us a year too late to maybe focus solely on the health systems as we do today. And I think it definitely it was worth the effort there. So that's the first thing. The second thing for like really early stage pieces is it can be really daunting trying to go into healthcare because it's an industry that really respects experience, really respects your case studies and your customer base. So it's really hard to get the first couple of customers, and it's really hard to integrate with the different systems, be it the EHRs or these old on-prem type of integrations. But I would say don't fret, understand what it is you need to do. And it's going to be slightly longer than it is maybe in a different industry. Well, once you're in, you're in. So don't fear and find the customer base that's willing to be your early adopter and treat them as such. They will stay with you. The relationship part in healthcare, I think, is really important, especially because you're touching, maybe patients and these types of things. And that's part of why it is so important. So these are the two things I would tell any founder that's going into the health tech type of space.
Great advice. Fantastic discussion. I really appreciate your time, Rom, and thanks for everything you're doing to make the healthcare experience easier for patients, for consumers. Best of luck with everything you have going on.
Thank you very much, Jared. It was such an interesting conversation.